Hi, my name is Shreya Duvvuri. I'm currently presenting from the United States, California, and my presentation is going to be about debunking addiction myths, addressing common misconceptions, and implications for reducing stigma. So, how does addiction affect individuals? My research paper addresses and debunks the longstanding myths about addiction, which is medically known as substance use disorder, that people often assume. So addiction being a choice, a matter of willpower, maybe a behavioral issue. All of these statements are actually incorrect. And the truth is, addiction is an illness, it's a disorder. And people affected by this disorder, they're often demonized or ostracized, but there's so much more to them than just being like an addict. And the goal of my topic specifically is to raise awareness about the reality of those living with substance use disorder. And I hope to destigmatize the topic and educate others about this disorder by raising awareness. I think that addiction is a very difficult issue to deal with, and medically, it's an illness. It can be managed with the proper treatment styles. So the notion that addiction is a behavioral issue rather than an illness that warrants treatment is actually damaging rhetoric. The inability to stop using whenever they choose to is a primary characteristic of users with addictions. Any opposing view to this claim isn't just uninformed or ignorant, but it can also prevent people from accessing the care they deserve and it further stigmatizes the disorder. Things like psychological therapies and medications that actually target these substance cravings in the brain can work in parallel to manage the disorder. And there are several complex factors actually that increase the risk of developing substance use disorder. So some of these factors could be trauma, genetics, or an increased impulsivity or comorbidity between substance use disorders and personality disorders. So, traumatic experiences such as physical, domestic, and sexual abuse during childhood or even in adulthood can contribute to an increased likelihood of developing an addiction. Um, and there's a statistic that says that 60 to 70% of women enrolled in substance abuse treatment reported a history of intimate partner violence. So we can clearly see this kind of association between substance abuse and having a history of traumatic experience. Um, I guess that addiction could also be kind of hereditary, where children of individuals with substance use disorder could have a higher chance of developing the same disorder as their parent. But there's kind of a sort of misconception here that there's something like the addiction gene. But the truth is that addiction isn't like one gene. It's numerous genes that have complex interactions, which can increase your tendencies to develop addiction, or gene variation can cause an increased possibility of traits like impulsivity, risk taking, stress reactivity. And when you put these things together, you can see how there's an increased vulnerability to addiction. Like I said earlier, comorbidities between substance use disorders and personality disorders have been well documented, and they're often observed in clinical settings. So, comorbidity between personality disorders and substance use disorders are actually more likely because of their shared criteria and these impulsive behaviors specifically. So, again, it puts you at a higher risk for developing addiction often with personality disorders because these traits such as impulsivity or risk taking can lead to abusing substances, because a lot of the time it can be like an impulsive decision. So another topic I wanted to touch on was addiction and marginalization. So for the last 100 years, there has been an intertwined association between drugs and people of color. So white users or white people with substance use disorders are actually often sympathized with, while Black and brown users are criminalized. And ethnic minorities are often associated with addiction. And your studies of media content determined that Black criminal suspects are actually depicted more frequently and violently than white suspects in news stories of crime and drug use. Views towards opioid users could be determined based on whether the public believes that the addiction is caused by the opioid user's responsibility or if the cause is in their control. And again, this kind of leaves space to racially profile people, kind of have racial prejudices towards people. And again, it can contribute to stigma of the disorder as well. So, I mean, factually, being part of lower income communities or part of a lower socioeconomic class can bring a higher risk of addiction because of heightened drug exposure, cultural norms within these communities growing up, and definitely a limited access to mental health services, addiction resources, and knowledge about addiction because mental health services can be quite expensive. Rehabilitation can be expensive, and these resources and the knowledge about addiction, um, it can take a certain level to kind of get all the knowledge you need about it. And some of these resources can only come to you if you're financially stable or if you could afford it. And the reality is that it is expensive, and a lot of people can't. But the truth is that addiction can affect anyone at any stage of life and from any socioeconomic, racial, or ethnic background. So there are multiple approaches to treatment for substance use disorders. There are 12-step groups. There are healthcare practitioners you can reach out to. There's rehabilitation facilities, and there's outpatient and inpatient rehabilitation facilities. And like I said earlier, there are medications which can help alleviate withdrawal manifestations among patients with severe physical dependence on specifically drugs, usually. And, there's controversy surrounding usage of medication and treatments, which can be attributed to the fact that prescription opioid use is actually a big problem and it's a contributor to addiction rates. But truthfully, sometimes when this source says when there's a severe physical dependence on drugs, it's very difficult to just quit, go cold turkey and go off of it because you are craving that substance so bad that you will do anything. You'll chase that high, right? So these medications kind of assist in almost like harm reduction, where yes, you're still on a sort of drug, but they can reduce the dependency, and they can slowly kind of wean you off of the drugs you were using earlier. So it can definitely be a very useful tool in recovering from substance use disorders. So, a big misconception is that rehabilitation is an instant fix and that relapsing after entering rehab is a sign of failure. But the truth is that rehabilitation is not an instant solution. To overcome addiction, individuals have to make the choice every day to keep trying and implement strategies that they're taught in their treatment programs. So it's not just signing up for rehab and going in and coming back out. You just need to keep making that choice every single day to, continue utilizing whatever tools and resources you were given. And like I touched on earlier as well, treatment for addiction can be quite expensive. And it can discourage people from seeking reform. The costs can add up with medication and rehabilitation, talking to healthcare practitioners, especially for lower income or uninsured individuals, specifically in America, seeking treatment for their addiction can just be impossible financially. So I truly think that lowering the cost of treatment is important to make it accessible and to better the state of those who need those treatments. So I just wanted to close off with a short discussion, just saying that, the stigma which kind of surrounds addiction is largely due to, misinformation, ignorance, and a lack of compassion for people who struggle with substance use disorder. Individuals who are affected by addiction or substance use disorders are not at fault, and it can be instinctual to kind of blame them for the disorder. But the truth is that there's a combination of complex factors which trigger and worsen this disorder. So it's important to be empathetic and understanding in order to create a foundation for effective treatment. Individuals with addiction should be given, sympathy and resources rather than judgment, because it doesn't help them, kind of overcome it, unfortunately. And destigmatizing addiction is really the key to helping individuals with substance use disorders and improving the rate of recovery from them. Here are the references I used in my slideshow and my paper, and thank you for listening.